Hey, this is Matt and welcome back to the channel, guys, where I'm going to be talking about Paulo Costa's 4-month result after his hair transplant. We should be able to expect about 30 to 40% hair regrowth, as it's normal after FUE or FUT around the 4-month mark, especially if the hair had been grafted in the front, as it was the case with Paulo Costa. However, there is this one thing called potential shock loss on the recipient area if you are a diffuse thinner like Paulo Costa was before and you decide to have that hair grafted in the very close proximity of your native hair. Now, what happens? Will the result be as great as if it would be grafted on the completely bald surface? This is the point of the discussion in this video. So if you are a diffuse thinner, if you are considering a hair transplant, make sure you stay tuned until the end of this video. Make sure you smash that like button. And before we start with the video, guys, this video has been brought to you by GoFiber, which are hair building fibers you can use to mask any thinning or patchy areas on your scalp to make your hair look thicker and better. So make sure you check out the link in the video description below, where you can visit GoFiber, get a free sample of your choice from them and try them out. See if you like them. Hey, welcome back to the channel. Once again, good to see you, everybody. I'm your host, Matt, on this channel where I'm talking about topics like hair loss, hair transplant, how to avoid being the bald guy for life, and how to do something about your hair loss, how to intervene early on, how to get on the proven treatments, and then educate yourself about getting your hair back with a hair transplant, get that hairline to the next level in a good density, in a nice frame, the way you want it. You know, it's like design what you literally want to have on your head in terms of hair density and shape whatsoever. Now, if you want to educate yourself more about how to do it properly, how to research correctly, how to avoid a bad result and avoid all the mistakes that guys usually are doing during their hair transplant research, make sure you stay tuned to this channel, subscribe, hit that notification bell, and also go to my website mattdominance.com, where you can inform yourself extensively and more in depth about these topics. For all of you guys who haven't watched the first video, my breakdown of Paulo Costa's hair loss progression and him getting his first hair transplant and the whole analysis, which you can watch here, highly suggested. Let me give you like a 20-30 second summary of what happened. So this is Paulo Costa this year in May, 1 month before his hair transplant, and we see, although his hairline is not that problematic, we see that he's diffusely thinning in the whole frontal third, actually behind his hairline and his frontal forelock, sorry. So he decides to get a hair transplant. I estimated this to be around 4,000 grafts, plus minus 200-300. Obviously, maybe 80% of these grafts had been grafted to the frontal third and the rest on the crown area, because both had been balding. Now, what is the disadvantage of doing this if you are a guy who is diffuse thinner? And I don't know if he was on medication prior to that or not. You know, usually you should test your response to medication like finasteride. If you are guy like who is in his shoes with the diffuse thinning, you should test your response for at least a year before you decide to get a hair transplant, to see how much strengthening you can achieve with the finasteride minoxidil dermarolling combo, and obviously ketoconazole shampoo as well, and then consider hair transplant. I have no idea whether he has done it or whether he had just opted for hair transplant straight away. One of my subscribers asked me, like, can you do a video of going more in depth of the so-called shock loss? What kind of impact it really has on your existing hair? So that's a good comment, and I'd like to elaborate on it here in this video for all you guys who are diffuse thinners considering a hair transplant. Now let's go more scientific about that shock loss on the recipient area. And yes, this is a study which talks about complication in hair transplantation, and shock loss on the recipient area can be considered a complication in the hair restoration, because it's not gonna help the patient achieve the most optimal result. Even if you get, like, let's say 3,000 grafts transplanted on the frontal third, which is diffusely thinning to begin with, these 3,000 grafts, even if they will grow, even if 90% of them will grow, which is a good survival, by the way, some of that existing hair will be weakened, may not be immediately weakened, and may not immediately fall out as a result of the shock loss, but it may happen over the maybe next couple, half a year or two. In more like medical or more professional terms, shock loss or recipient site effluvium is seen in variable degree in most patients who continue to have pre-existing hair within the transplant zone. The reason for this is anagen effluvium, telogen effluvium, or sometimes combination of the two, and typically begins 2 to 6 weeks following the surgery. So that's the shock loss, okay? The shock loss, by the way, happens anyways, even if you don't have have diffuse thinning and you get a hair transplant. Even if you get a transplant on the balding areas, even the transplanted hair will fall out, usually 90% of it. And this is Paulo Costa's hair 2 to 6 weeks after the surgery. You can see how the frontal thread is like severely affected by shock loss. Here you can also see the shock loss, how far it's actually reaching. And as the shock loss is pretty much affecting all of these transplanted areas, it can then also start to pick up that native hair, which is weakened, and it can make it like fall out. So that's why also the shock loss on the native hair. It may sometimes cause a permanent reduction in a native hair population, particularly in a patient with pre-existing miniaturized hairs, which Paulo Costa was, and many of you guys are also who are maybe considering a hair transplant as a diffuse thinner. Systemic steroids post-op, starting minoxidil early, that is, within 2 weeks of surgery, and even oral finasteride may help in reducing the risk and early recovery. So yeah, that's pretty much what you should be doing if you want to minimize that shock loss on the existing hair after your surgery. If you are like Paulo Costa, you have diffuse thinning across the mid-scalp or frontal third, and you decide to have like pretty like a big surgery done, like Paulo, like 4,000 grafts, then you should consider it in order to like not end up with only the transplanted hair growing eventually and like a big portion of that existing hair not surviving or miniaturizing over the next year or two much faster as it would have normally miniaturized in case you like didn't have a hair transplant, or in case you did a hair transplant and you did start medication as well. The good thing about finasteride is that you can take it before your transplant, after your transplant. It has no impact on the surgery, on like bleeding and trauma to the recipient area. That's why only minoxidil is advised to be discontinued before the surgery, and then it can be resumed again after 2 weeks after your surgery. That's what normally physicians advise. And now let's come to the most exciting part of this video, which is going to be the 4-month mark of Paulo Costa's hair transplant journey. And I'm going to be blending the before situation and the current situation and the 4-month mark so you can see what's going on. So this is from the recent interview from the UFC 241, and we can see Paulo Costa's hair obviously pretty disadvantageous lighting. I would like to point it out right away because it's very harsh lighting. So obviously this is going to make his hair look slightly worse than you know, when it's not going to be flashed with so much lighting. But nonetheless, if we take a look at his hairline right now as it is, and then if we take a look at his hairline before, and this is his hairline before his hair transplant, I mean, it should look better right now. Okay, it should look better right now, although we know it's not the full result. Obviously the 4-month mark, it's not the full result, but the hairline should be denser, you know, it should be fuller. I don't know, let me know what you guys think in the comments below, but something is not quite adding up there. I don't know. If we go to the more favorable angle, or you know, less harsh lighting, this is another angle, it's darker obviously, so we can see that the hair looks fuller, but still the hairline is not that defined as I would wish. Considering the high amount of grafts that had been planted, by the way, you can see how the dense packing was on the hairline, and you can see how the situation was before. I mean, the hairline wasn't that receded, it was fuller than the areas behind it. So I am wondering by the 4-month mark that the hairline is not looking fuller. That's the first thing. The second thing are the areas behind the hairline, which in my opinion could have been focused on more. If we take a look at it from this angle, we can see obviously that these areas are still lighter, and we can see through that. We can see the scalp, especially from angles like these. Between now and the next 2-3 months, these areas, I'm hoping they will fill out much better. If not, I would be slightly concerned actually here. He has that nice hair characteristics playing in his favor. He has this nice low skin to hair contrast playing in his favor, medium to high hair caliber. Also his donor area, I looked it up from other angles when he was like posting stories on Instagram, and it looks pretty good. I mean, pretty healthy. It doesn't look over harvested or nothing like that. So that's good, obviously, but you know, I'm always looking back at the before situation and I evaluate the result based on the before situation plus the high, like considerably high amount of grafts that he got for the frontal third, which I estimated to be about 3,000. So considering all that, I would expect something better for 4 months, to be honest. So that's all I'm trying to say. So let me know what you think again. Thank you so much for watching. Check out our free Facebook group, Hair Transplant Experiences, in order to exchange your experience with other guys in the group. Visit my website, Matt Dominance. As I already said at the beginning of this video, if you want to inform yourself on topic of hair restoration, educate yourself, and you want to kind of get ahead of that average guy who is just getting a hair transplant by acting impulsively rather than rationally, then really evaluating that stuff and going in depth based on your individual situation. These are the things that I'm helping out guys to find out and figure out during their hair transplant research as well, individually, one-on-one. So if you're interested in working with me together on a one-on-one basis, you can check out my website, check out mattdominance.com/mentoring, where you can get on a one-on-one call with me, and I will be happy to assist you throughout your research. So that was it from me, guys. Take care.